All right, today we are diving deep into a single medication that does double duty for people with asthma and COPD. We're talking prevention and relief all in one package. Let's get into how this dynamic duo actually works.
I mean, think about that for a second. What if the same inhaler you use every day to keep things under control was also the one you grab for quick relief when you need it most? That one simple idea is exactly what makes this medication such a total game changer.
So, to really get why this combination is so effective, you first have to understand the battle that's constantly being fought inside the airways. It's really a fight on two completely different fronts. On one side, you have this chronic low-level inflammation. You can think of it like a slow, smoldering fire that's always making the airways swollen, irritated, and super twitchy. Then, on the other side, you have the sudden attack, a bronchospasm. That's when the muscles are on the airways just clamp down and squeeze shut, right? Two very different problems that need two very different solutions.
And that, of course, is where our two heroes come in. See, this isn't just one drug. It's a team of two, packed into a single inhaler, and each one has a very specific job to do.
Let's meet our first hero, Budesonide. This is the strategist, the one playing the long game. Its entire mission is to deal with that slow burn of chronic inflammation. Budesonide is what's called an inhaled corticosteroid, or ICS for short. Now, the keywords to remember here are overtime and prevent. This isn't for an immediate attack. Nope, this is a long-term strategy to fundamentally change the conditions on the airway battleground. So how does it pull this off? Well, it uses a three-pronged attack. First, it tells the inflammatory immune cells to stand down. Second, it blocks the chemical signals that trigger all that swelling and mucus. And the result? Over time, the airways just become calmer, less twitchy, which means fewer flare-ups down the road. Okay, now for our second hero, Formoterol. If Budesonide is the long-term planner, Formoterol is the first responder. Its job is to tackle that sudden squeeze and open the airways up and do it fast.
Formoterol is part of a drug class called long-acting beta-2 agonists, or LABAs. You know, it's a mouthful, but its function is super simple and direct. It's a bronchodilator. It relaxes those muscles that are squeezing the airways tight so that air can finally flow freely again. Its mechanism is almost like flipping a switch. It targets these very specific spots, the beta-2 receptors, that are sitting on the airway muscles. When it latches on, it sends a powerful signal that basically just says, relax now, forcing that sudden squeeze to let go. Now, here's what makes Formoterol so special in this partnership. It's this unique combo of speed and stamina. It starts working in just 1 to 3 minutes, which is incredibly fast for a long-acting drug, and then it keeps working for at least 12 hours. This blend is really the secret sauce to the duo's power. So when you put these two heroes together in one device, you get something truly amazing. It's a single inhaler that gives you both that long-term prevention and that desperately needed rapid relief. For COPD and some people with asthma, it's used as a standard maintenance therapy, twice a day. But for asthma, this combination unlocks a really revolutionary approach called MART. That stands for Maintenance and Reliever Therapy. With MART, you use the exact same inhaler for your scheduled daily dose and as your rescue inhaler whenever symptoms flare up. And this is huge. Clinical guidelines now recommend this approach because it's been proven to dramatically cut the risk of severe attacks. The real beauty of the MART strategy is this. Every single time you reach for your reliever, you're not just getting the fast-acting Formoterol. You're also getting an extra dose of the anti-inflammatory Budesonide, right at the moment your airways need it the most. It's just a smarter way to fight the battle. Now look, having this power is one thing, but using it correctly, well, that's everything. You can have the most advanced medication in the world, but it's completely useless if it doesn't get where it needs to go, deep inside your lungs. So technique is absolutely critical. First, you breathe out, empty your lungs completely. Then you form a really tight seal with your lips around the mouthpiece. Now, this next part depends on your device. If it's a dry powder inhaler, you need a fast, deep breath. If it's a metered dose inhaler, it's a slow, steady breath. And finally, you hold that breath for about 10 seconds. Let the medicine really settle in there. And this next part, this is non-negotiable. After every single use, you have to rinse your mouth with water, gargle really well, and then spit it out.
That corticosteroid, budesonide, can cause a pesky fungal infection called oral thrush if you just let it sit in your mouth and throat. This simple step prevents that from happening.
Okay, and like any powerful tool, it's really important to understand the potential risks so you can use it safely and get the best results.
Some of the common side effects can be things like a headache, maybe some shakiness, or a feeling that your heart is beating fast. That's from the Formoterol. You might also get a little hoarseness or throat irritation. And of course, there's oral thrush, which, as we just talked about, is largely preventable if your technique is good. Now, we have to address a very serious warning. Research showed that for asthma, using a LABA like Formoterol all by itself could actually increase the risk of some very serious outcomes. This led to what's known as a black box warning from regulators, which is the most serious kind. But, and this is a critical but, here's the solution, and it's literally built right into the design of this inhaler. That risk goes away when the LABA is always paired with an inhaled corticosteroid. So the combination isn't just for convenience, it is a fundamental safety feature. The two heroes have to work together always. So, as we wrap things up, let's just put it all together. This medication is a true cornerstone of modern respiratory care, but it's part of a team.
Its effectiveness really depends on a partnership between your doctor who makes the right diagnosis, the medicine itself, and most importantly, your commitment to using it correctly every single time. The medication can't do its job if you don't do yours. So in the end, this single inhaler holds two powerful heroes fighting that airway battle on two different fronts. But their success ultimately depends entirely on the most important member of the team, you. So the real question is, are you ready to play your part?